breast cancer is nothing but the cancer of the breast. So cancer can affect any organ in our body. Cancer arises basically because of certain cells which develop a growth advantage by acquiring certain mutations during their lifetime. Commonest signs and symptoms of breast cancer starts off as a lump or a swelling in the breast, and more often than not it starts off as a painless swelling. So there is no pain in the swelling or the lump, which is why most women tend to ignore it. They are shy to come forward, and because it's not hurting them, they don't want to come forward and show it to somebody, which is why many of the times when we see the patient in our clinic, it is in an advanced stage because they have failed to come early. But any small lump which you feel, which is new, which is increasing in size, could be a very, very early sign of breast cancer, and it must be addressed immediately. There are certain other signs and symptoms as well, which is one is like any nipple changes, or an inversion of the nipple, cracking of the nipple areolar region, discharge from the nipple, bloody or a lot of discharge coming out of the nipple, change in the shape or the size of the breast. In very advanced stages, sometimes even the skin can get involved, and the skin feels like the skin of an orange. It's a very rough texture to the skin because of the involvement of the skin, which we also call sometimes as inflammatory breast cancer. So there are definitely risk factors, because we see that some women get breast cancer, some of them don't get breast cancer. So you can divide them into two categories. One are non-modifiable, or something that we cannot change about ourselves but which still puts us at an increased risk. For example, aging. Age is something that is not in our control. Increased age results in an increased risk of breast cancer. Being a woman itself puts us at a risk for developing breast cancer. Our family history or genetic makeup, especially women who have a very strong family history of breast or ovarian cancer, tend to have an increased risk of breast cancer. There can be hereditary genes which we have inherited from our parents and grandparents, which can put us at risk for developing breast cancer. These are few risk factors. Our menstrual history, our hormones, these are some things that we cannot control or change. Then there are risk factors that can actually be modified, or which we can do something about to reduce our risk. So the most important I think amongst these are obesity and physical inactivity. Both of these have shown to be associated with an increased risk of breast cancer, not only in normal population but also in women who have previously suffered from breast cancer. If you are physically active, if the weight is controlled, your risk of breast cancer definitely comes down. Additionally, other factors like smoking increase the risk of breast cancer. In today's world, because of urbanization, women working, women going out, a lot of modernization has happened. Adoption of Western culture has happened. So late marriages, single children, breastfeeding is not proper. So there are so many other factors which can contribute to your increased risk of breast cancer. If you exercise regularly, if you control your weight, avoid bad habits like smoking, preferably, have early pregnancy, all these things can definitely contribute to reducing your risk of breast cancer. Although the risk never becomes zero, but definitely you can take care by adopting a very healthy lifestyle, eating healthy diet, and obviously being vigilant. So whenever you see those early signs and symptoms, please go to the doctor so it can be detected early. So definitely there are genetic risk factors for breast cancer. If you take about 100 breast cancer patients, about 10 or 15 of them will be because of a genetic risk or a genetic predisposition. So how do we decide who to test for? We look at the family history. If there is a very strong family history of either breast cancer or related cancers like ovarian, pancreas, stomach, then definitely we suggest to undergo genetic testing. And based on the genetic report, we decide whether any patient or any person has a particular gene which is defective, leading to an increased risk of cancer in that particular person. If you find something like this, then we put them on a more aggressive screening protocol, which is doing maybe MRI every 6 months or mammo every year, alternate with MRI depending upon the age of the individual, ultrasounds, etc. So we try to self-breast examination, clinical examination, all these things we try to do to find if we can detect the cancer early. In addition, we also advise that if you have especially BRCA1 and BRCA2, which are the most studied genes in breast cancer, which increase the individual's risk by almost 70 to 80% to develop breast cancer. In these individuals, we can also offer certain prophylactic surgeries. So we advise that you please, sort of complete your family early. So you can undergo either prophylactic mastectomy or removal of the breast, prophylactic ovarian removal, because increased risk of not only breast cancer but ovarian cancer is known in individuals who have these genetic mutations. So these prophylactic steps can also be suggested if we know that you have a genetic risk of developing breast or ovarian cancer. If you look at early stage breast cancer or stage 1 breast cancer, the cure rates are almost more than 90%. So, the earlier we detect it, the better your chance at cure, and the treatment is also better. So it's a early small tumor. We can even conserve the breast by, during surgery. We don't have to remove the entire breast. Whereas if you come with a large tumor or in an advanced stage, the treatment options are limited. So we may have to remove your entire breast. You need additional radiotherapy. You will need chemotherapy. Early stage certain tumors, we may not give you chemo at all. You may just be good with hormone therapy. So early stage is very, very important, not only because it lowers the treatment, it also improves survival. So early detection basically is very, very important. How do I detect it early? One is because I am vigilant and I can detect the lump early, or I can detect signs and symptoms early. For that, screening is important. What is screening? So screening is nothing but trying to look for cancer in an individual who has no symptoms. So even without symptoms, we are trying to look for something, whether there is some abnormality. Most important of these, I would say, self-breast examination. Every woman after the age of 20-25 should do a monthly self-breast examination. Self-breast examination is nothing but checking your own breast with your own hands, and it takes about 15 to 20 minutes. Do it once a month, just after your periods are over, maybe 5 to 7 days after the period, and you will be able to notice the changes yourself and come to the doctor. Other ways to do it is mammography once a year. This is advised mainly in women who are older than 40-45, because younger women we don't want to expose to unnecessary radiation. In younger women, like I said earlier, we may want to advise you MRI of the breast depending upon your genetic risk of breast cancer. So screening is important to detect it early. Early detection is important for better survival. So there are different types now. Initially, long time ago we used to treat all of them alike, but now we know that there are different types. So one treatment may be suitable for one woman, the other treatment may be suitable for another woman. This is because some of the breast cancers may be hormone sensitive or hormone responsive. Some require targeted therapy. Some are triple negative or more aggressive tumors which require more chemotherapy, or there are various ways to typify these tumors, and based on the type you have, the stage you have, what age you are, whether you have any other additional illnesses, based on these things we decide what kind of treatment is most suitable to you, and that is how we decide the treatment. It is very important to be mentally strong. It is not it is not easy, but it is very important to be able to accept the diagnosis and go through the treatment. I will agree that this is not easy for an individual. It is tough to accept, when somebody is diagnosed with cancer, the first thing that comes to mind is, death, because all our life we have been associating cancer with death. But this is fast changing. There are multiple treatment options available. Yes, it is a long journey, it's an arduous journey, it's a big fight, but definitely people are successful, and at the end of treatment you can get back to your normal life. You can get back to enjoying how you were traveling, you were working. But it is very important, and mental health, it helps you cope with the diagnosis, and it helps you fight it with more positive energy. So I would say that you need a lot of counseling, and if you need it, if you feel low, don't be shy to take it. You must take it so that you can fight it better. There are many misconceptions that I see around. Most importantly, first thing is, if I have no family history of cancer, I'm not going to be at risk of developing cancer. So, only people who have family history will develop breast cancer. That is not true. Even if you have no family history, you can still be at risk because of all the risk factors that I just told you. Also, people feel that if they have a healthy lifestyle and if they are not having any bad habits, then they will not develop. It is not that. It can affect anybody at any time. Even younger women, age less than 40 also, we are seeing lots of women with breast cancer. So just because you are younger, you are fitter, doesn't mean that you will not get it. That's a very, very important myth. Other myths are about bras. A lot of people feel that if you wear the underwired one or the black or this, at night, these cause increased risk of breast cancer. But that is not true. You can easily wear your bra whatever color you want, whatever time of the day you want. It is not going to increase the risk of developing breast cancer. Other myths include drinking milk or eating sugar, and all these things will also increase the risk. There is no known association found with this, no known association found with increased mobile use and breast cancer. So there are lots of myths, but I think it's best important, if you have a doubt, just clear it with your doctor whether you are at risk or no. It's a very good question. There are males also who can get breast cancer, although the incidence is very small. Most commonly, it is women who are affected. So if you take 100 breast cancer patients, one of them will be a male breast cancer. 99% of the times, it will be a woman who has breast cancer. But that does not mean that males are not at risk, especially if there is a family history of BRCA positivity. Then we know that in these patients, males can also develop breast cancer. So it is not a guarantee. If there is a strong family history, we do a genetic test. So suppose if I find some genetic abnormality in the mother or father, they are positive for say BRCA. So there is a 50% chance that the offspring, the daughter or the son will also be positive. So if the daughter or the son are also positive, then definitely the risk is more. But if they are negative in terms of that particular gene, then their risk becomes as the average population or normal population, and they're not at that increased risk of BRCA positivity. So there are various aspects to this particular question, I would say. So breast cancer per se does not stop you from bearing a child. What happens is the treatment that you go along with, not the surgery or the radiation, but especially chemotherapy. Chemotherapy has its own side effects, and one of the side effects is affecting the fertility also. So there are people who can do oocyte preservation or ovarian preservation. You can take certain injections to try and sort of preserve your ova or ovaries so that you can later on get pregnant. But having said that, while you are on treatment, like suppose if you have taken chemotherapy, or if those who are hormone responsive cancers, those who are on hormone therapy, we do tell them to defer the pregnancy for at least 5 to 6 years, because there is a risk of the disease coming back. So once that period is over, definitely you can try for pregnancy. There are different techniques now for IVF, and there are women who have also naturally got pregnant even after treatment for breast cancer. So definitely there is some side effect in terms to which affects fertility, but there are ways to sort of circumvent around it. Actually, it is the other way around. Breastfeeding has known to be protective against breast cancer. So that is one thing. Secondly, but what happens is many women can develop breast cancer during pregnancy or during lactation, what we call as pregnancy associated breast cancer, especially those women who get pregnant late in life. So there may be the slight increase in breast cancer is seen during pregnancy and lactation. So during breastfeeding, many times women will develop lumps or swellings, which may be just galactoses or milk ki doodh ki gaant is what everybody calls it, or they can sometimes develop infections, etc. So these things tend to get ignored because it's all related to the breastfeeding. But you have to be vigilant to know that if something which is not improving, something which is not improving in spite of treatment, that has to be seen by a specialist so that adequate investigations and treatment can be started. Actually, it is the other way around. So if you've developed breast cancer once, then the risk of developing breast cancer in the other breast is also very high. So which is why all women with breast cancer are asked to undergo regular checkups, regular mammographies after their treatment, so that any other cancer can also be detected early. So it is not that if just because you've got breast cancer once, you'll never get it again. It can definitely come back, or you can develop a new breast cancer in the other breast as well. No, definitely not. So there are lumps which are benign. Benign basically meaning that they are not cancer. Especially in younger women, teens, there you can develop these lumps called fibroadenoma. These are benign lumps. Very rare chance of it ever converting into a malignancy. It is very uncommon. So we don't usually advise any kind of follow-up also for these. If you feel that any lump is growing too fast, or it's in changing size, changing shape, then at that point in time we address it. But there are benign lumps also. You can have fat lumps also. So not all lumps in the breast means that they are breast cancer. The most important message I would like to give to all the women outside today is that please take yourself seriously, take your health seriously. Please go to the doctor if you find any abnormal symptoms or signs, because if you are healthy, then you can take care of your family. And breast cancer is not the end of life. You can cure breast cancer and you can get back to a normal, healthy life.